And just wanted to say I met Mr. Coyne and Ms. Cummings back in 2014. You know, one of the issues when you've been around as long as I have, I think there's still only right now just myself and Sheriff Roper out of Clark County that were actually on the command board of the Drug Task Force at the time when 2014 was here. And one of the things that we'd been meeting with regularly and talking about was the issue of the heroin cases that we were working in our region. One thing that came out of that is the public meeting that he and Lauren talked about, which brought a large part of that community, the Winchester-Clark area community, together. And of course, we were part of that. And we had identified the heroin issue as a heroin epidemic at the time. It is still a major issue in our county, and I would say it's also still a major issue in Warren and Page County as well. And as far as I'm concerned, I think now is the time we need to seriously sit down and talk about this initiative. It's taken a long time to get here, but it's time. And also, quite frankly, my contact with Lauren and Mr. Coyne and what they've done in Frederick, Winchester, and Clark, it is a model that I think you need to pay serious attention to, because I think it's very effective. And I think if we were going to embark on such an initiative, I personally would look at their model and try to guide myself as much as I could through that, because they've been very successful. Just to give you some local numbers, Narcan administered, now we'll talk about what this means in just a minute, but as you can see over time, we're having more and more, I guess I wouldn't call it opportunities, but incidents where we are administering Narcan. This is what we know about. These are the calls that we're called to. This is Shenandoah County Sheriff's Office and EMS in Shenandoah County. And that's a reflection of basically this number here. These are your injuries and deaths. And as you can see, we're on track in 2021 to at least match 2020, if not exceed 2020. So COVID didn't slow anything down from a respect of people's heroin addiction. And that's another thing here. You know, I realize Judge Black probably, I don't know if he's going to speak this evening, but I will tell you one thing that I know regarding heroin addiction and people that are addicted to heroin. Jail is not a deterrent. It's an addiction. So not in the sense of, you know, as you think about, you know, criminal conduct, people are dealing with an addiction that they have to have other services to get through, dealing with that piece of their life or what's controlling their life. But these are your heroin injuries and deaths over the last 4 years. And this is just another way to look at it in this particular chart. Again, that's really all I had to say this evening, other than to say that I support what they're doing. And I think the board should take a position that we need to start getting into how we can fund this and how we can get this initiative off the ground. In Shenandoah County, we'd be very supportive of it with the Sheriff's Office. And I know we're running into probably some grant deadlines that we would want to certainly meet this fall, and I'm sure Mr. Coyne or Lauren can speak to that if there was a specific question about that. So again, thank you for your time, and I appreciate it. Mr. Chairman, we would have space in our new facility. If you needed an office, there would be an office available in our facility. If that's the concern. The issue for us is the person and getting the county position. It would be report to the county or Valley Health or whoever is the entity that this person will report to. But if you needed a physical space, I think that's not going to be that difficult at this point.